We rushed out the door, and then we drove in circles looking for parking at the hospital. I was so excited to meet our baby, but I was also nervous because as a family medicine physician, I had seen many of the complications of birth firsthand. And my concerns were valid, as severe and life-threatening complications had doubled between 2002 and 2014. More recently, the CDC released data in 2021 showing that maternal death around childbirth had nearly tripled since the early 2000s. This statistic placed childbirth at number 6 if it were on the list of deadliest jobs. Every complication and death impacting the person giving birth has ripple effects that also impact their baby, their partner, their family, and their community. Birth has become a space filled with fear. But this was not always the reality. Dating back to Paleolithic times, there is evidence that women would support each other as they gave birth to their babies. And over time, the collection of knowledge and wisdom around birth led to the development of midwifery care. By the early 1700s, midwives were well-respected members of their communities. And although data is limited, it is estimated that maternal death impacted around 0.5% to 1% of all births during that time. But in the mid-1700s, things began to change. Many countries began establishing free hospitals to deal with the injuries and infections that came with industrialization. Poor and disenfranchised women began going to those free hospitals to give birth to their babies. But healthcare providers had a very limited understanding of physiologic birth. You see, prior to this time, they were only involved in birth during times of crisis. This was because midwives and their patients typically did not allow male physicians to attend deliveries. Throughout the 1800s, this lack of knowledge around physiologic birth, combined with a poor understanding of how infections are spread, resulted in increasingly more dangerous and traumatizing deliveries in hospitals. For instance, physicians built upon techniques that were historically only used as last-ditch efforts to try to save either the mom or the baby in the most dire complications of birth. By utilizing those techniques more routinely, they caused much more harm than good. They also spread deadly infections as they went straight from doing autopsies to doing exams on laboring patients without washing their hands in between. By the early 1900s, hospital births had some of the highest maternal mortality rates in the history of human birth. The New York maternal mortality study found that nearly 5% of women giving birth in hospitals were dying due to complications of those births. Despite this data, 99% of births were happening in hospitals by 1955. This was because laws were passed restricting midwifery care, and marketing campaigns were run by hospitals promising pain-free births and promoting new technologies. But throughout the 1900s, women went through decades of traumatizing experiences as those new technologies were experimented with. They were forced to lay on their backs and physically tied down, and then left to labor alone. They were injured by the instruments and techniques that were supposed to help deliver their babies. Many of them were made to forget the experiences that they had with medications that were given around birth. And to make matters even worse, hospitals separated parents from their babies, thus disrupting their ability to bond. By the late 1900s, women began to demand change after having gone through dehumanizing conditions in this space for so long. They started to ask for less intervention, more autonomy, and better support around birth. Since that time, helpful technologies have been refined, and they are an essential part of preventing both maternal and infant death today. But despite those advancements, 1 out of every 3 births is described as traumatic. 1 out of every 5 people giving birth are diagnosed with either depression or anxiety. And 80 to 90% of maternal death was preventable in 2021. As a family medicine physician who focuses on postpartum care, the stories that I hear from my patients, my friends, my family, from the stranger on the bus, describe the reality behind those statistics. So many people describe a lack of empathy and support around birth. They often feel alone and helpless during a time when they should be nurtured and empowered. And while the stories that were entrusted to me are not mine to share, I can tell you my story today. We did find parking, and we made it to the labor and delivery unit. But our experience ended up being one filled with trauma and fear. Despite normal progression of labor, the physician on call insisted that we start high doses of medications to strengthen my contractions and speed the process up. He threatened me with a C-section if I didn't take the high doses, despite there being evidence that lower doses were equally effective with fewer complications. He then repeatedly pushed pain medications on me, despite knowing that I did not want them. And under the influence of those medications, the next several hours are a blur. The next thing that I remember is the nurse coaching me to push to try to deliver our baby for over an hour before she realized that she had made a mistake and I was not yet ready to give birth. When it was time to deliver, the physician again rushed me through the process, and then he ran out of the hospital even though I was bleeding profusely. He did take a moment to tell my dad on the way out that he had to get to a dinner reservation, and he didn't know why the nurses wouldn't let my parents see us. During a time of vulnerability, I was faced with fear-mongering, a lack of empathy, and impatience. And to make matters worse, many of the interventions that were forced onto me are known risk factors for excessive bleeding after childbirth, also known as postpartum hemorrhage. They directly resulted in multiple life-threatening hemorrhages before I left the hospital. Several days after going home, I started to bleed heavily again, but my concerns were dismissed by the OB's office. And while I knew I was bleeding too much, I was too emotionally and physically exhausted to advocate for myself. If not for my father, who is an OBGYN and reproductive endocrinologist, I would not be standing here talking to you today. Thankfully, he was there, and he rushed me to the hospital for emergency surgery when he saw how much I was bleeding. Without that surgery, I would have died at home within hours, if not sooner. I felt shocked, numb, and abandoned by the medical system that I had dedicated so many years of my life to. My husband recently told me that he felt alone taking care of our baby much of the time, and he didn't know how to help me. We saw firsthand how the lack of empathy around birth, combined with a need for the medical system to control the birthing process, can have such devastating consequences for families. But echoes of the love, support, and wisdom that have been lost in this space can be heard in the stories that my mother told me about my grandmother's deliveries. During the 7th month of her first pregnancy, her mother would have hosted a valakapu, which is essentially a South Indian baby shower. During the ceremony, experienced mothers and older women would have come to bless my grandmother to have a safe delivery. They would have celebrated her and placed dozens of glass bangles on her arms, which would serve as a tool to help distract her when she went into labor. She would have then spent the remainder of her pregnancy surrounded by her pregnant and newly postpartum sisters and cousins and their children in their ancestral home in Cuddalore, India. My great-grandmother and the other older women in our family would have used their knowledge, their wisdom, and their experience to guide their daughters and grandchildren through birth and postpartum with love. And while birth was by no means free of pain or risk, it was seen as a transformative experience to be nurtured and celebrated. You may have heard the phrase that it takes a village to raise a child, but children don't exist in isolation. In reality, it takes this kind of community of support to nurture new families. And while we don't all give birth, we all come from birth. So it is imperative that we work together to improve outcomes in this space. Individuals can make a difference by simply listening, expressing empathy, or maybe doing a few chores so that parents can really focus on healing and bonding with their babies. Healthcare systems can improve both outcomes and experiences with evidence-based methods, such as by using tools like shared decision-making and by facilitating the use of trained support people like doulas around birth. Communities and society as a whole can improve support for families through policy change, such as by passing paid parental leave policies, which have been proven to decrease maternal and infant hospitalization while also improving maternal mental health, infant bonding, and overall family well-being. Ultimately, we must stop leading with fear and start leading with care if we are to create a more connected and compassionate society for future generations. Thank you.